The EP lab and electrophysiology program at Overlake really has to do with our treatment of heart rhythms. And so basically we're looking at treating abnormal heart rhythms or issues with the heart's electrical system.
The partnership with Evergreen Health to provide arrhythmia care to the east side is huge. I think it just allows us to be able to keep patients on the east side. Arrhythmias or abnormal heart rhythms are situations where the heart may be too slow or too fast or slightly irregular in terms of its rhythm. In certain cases, however, the abnormal heart rhythm may be causing symptoms. Some of the risks of abnormal heart rhythm could be a stroke, heart attack, or cardiac arrest, but these are all fairly rare occurrences and certainly manageable with the correct therapy.
The type of arrhythmia patients suffer with depends on where those arrhythmias arise from. You have upper and lower chambers in the heart. The atria are the upper chambers, the ventricle is the lower chamber. The most common arrhythmia we encounter is an arrhythmia called atrial fibrillation. Typically, when the heart beats, it beats top and then bottom. But in atrial fibrillation, the top chamber becomes chaotic and the bottom chamber responds erratically to that arrhythmia. Some common symptoms of atrial fibrillation include general fatigue, a rapid and irregular heartbeat, fluttering or thumping in the chest, dizziness, shortness of breath and anxiety, weakness, faintness, fatigue when exercising, sweating, chest pain or pressure.
At Overlake Hospital, we use a variety of diagnostic tools to diagnose precisely what abnormal heart rhythm a person may have. We have quite a variety of different choices in determining what a person's symptom may be due to. Some of the tests that we order include tests like echocardiograms and electrocardiograms, heart event monitors, exercise stress tests, tilt table tests, electrophysiologic studies, and cardiac catheterization.
At Overlake Medical Center, we treat all types of cardiac arrhythmias. Depending on your treatment plan, we offer a wide variety of treatment options that include medications, electrical cardioversion, which is an electrical shock to the heart, catheter ablation, and heart rhythm devices like a pacemaker or implantable defibrillator.
Ablation is a minimally invasive procedure that we use to treat abnormal heart rhythms at their source. You're relaxing or asleep, we put tiny IVs in the veins in the groin area, and those veins connect directly to the heart. And we use those to study the heart's electrical wiring and electrical system, and then also to pinpoint and treat the cells that are causing the abnormal rhythms.
Catheter ablation offers an alternative to medication, and often medication fails, and that leaves us with catheter ablation as our only remaining option to treat a cardiac arrhythmia. Typically, ablation has performed over the last couple of decades using catheters that deliver either heat or cold energy to scar the heart tissue. Overlake Medical Center led the Pacific Northwest in offering pulse field ablation to our patients. This is a non-thermal method of ablation. It directly targets cardiac cells, which spares nearby tissues such as blood, vessels, nerves, and other organs. This offers a safer option of ablation for our patients.
When you have an abnormal rhythm called atrial fibrillation, one of the biggest issues with this rhythm is that it can cause blood clots in the heart that can lead to strokes. So what the left atrial appendage closure program is it really kind of flips the script on treatment for AFib. And we put a tiny IV in the groin area while you're asleep, advance the device into the part of the heart called the left atrial appendage where these blood clots form. Once it's healed in place, you no longer have to take blood thinners anymore, and you get the same level of stroke protection as being on a blood thinner. Overlake is a great choice for cardiac care because it really excels on a number of levels. There are so many providers here who are extremely conscientious, thorough, very, very invested in your well-being and your outcomes. The hospital itself is tremendous. The staff are tremendous. The resources we have to provide excellent care is really unparalleled.